Assalamualaikum warahmatullahi wabarakatuh. I am Hanadia Minudin, and today I will be performing the postpartum care. Postpartum care is a medical and supportive care provided to the mother and the newborn 2 weeks after the birth. It focuses on the mother's physical and emotional recovery. Now the purpose of postpartum care is to ensure the physical, emotional, and mental well-being of the mother, facilitating a smooth transition into parenthood. Position the patient in a supine on a bed, expose the abdomen. Ask the client to void first before starting if it is not catheterized. Observe the abdomen for contour and appearance of striae or diastasis. Now, palpate the fundus of the uterus by placing one hand on the base of the uterus, just above the symphysis pubis, and also the other hand on the umbilicus. Press in and downward the hand until you bump in a globular mass, which is the uterine fundus. After that, assess for consistency whether it is firm, soft, or boogy, and also the location if it is in the midline, and then the height. Measure the height of the uterine fundus in relation to the umbilicus. Measure them by using the finger breadth. For example, 2 finger breadth above the umbilicus and 2 finger breadth just below the umbilicus. We have to check this every 15 minutes for the first hour, and then we have to document the assessment in the fundus, and let us include the consistency, location, height of the fundus. And now for the lochia. Checking of the lochia can also be done while checking the fundus. You have to ask the client to turn on her side and then inspecting the perineum. You have to make sure that we check the area under the buttocks to observe any presence or pooling of the blood. After that, we have to note the lochia discharges every 15 minutes for the first hour, and then according to the institution's policy. After that, we have to note the character, amount, color, odor, and if there is a presence of hemorrhaging. And then we will document the assessment findings, and also we have to report to the physician if there is any sign of hemorrhaging. Now for the perineum. To check the perineum, we have to ask our patient to turn on her side in a Sims position, and then with her back towards you. We have to gently lift the upper buttocks to check the perineum. After that, we have to observe for ecchymosis, hematoma, erythema, edema, intactness, pus formation, and a presence of drainage or bleeding from any episiotomy stitches. After that, we have to document all the assessment findings. That's all. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Today I will be performing the fundal massage. Fundal massage, it is a procedure or an assessment wherein the examiner will massage the patient's fundus, and the purpose of this procedure is to massage the patient's fundus and also to check if there is any sign of abnormalities and to help in activating the uterine contraction. First, you have to explain the procedure to our client. We have to provide privacy, and then we have to ask the client to void first before starting the procedure, and then we will place the client in a supine position with their knees bent or flexed and their feet together. Next procedure is to put on gloves, and then we have to place our one hand on the abdomen just above the symphysis pubis, and the other hand around the top of the fundus. Rotate the upper hand to massage the uterus until it is firm, being careful not to over-massage the uterus. When the uterus is firm, gently press the fundus between the hands using a slight downward pressure against the lower hand. And then we will remove our hand and observe the woman's perineum for the passage of clots and the amount of bleeding. And then we will again massage the uterus again to be certain if it remains firm. After that, we will cleanse the perineum and apply a perineal pad. Discard the gloves and soiled pad, and then we will document the result of the procedure and notify the physician if the fundus does not remain firm or if bleeding continues. That's all. Thank you.